Hey, we're the Turd Nerds. We're glad you're here. Before we take the plunge, let us introduce ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and licensed acupuncturist specializing in digestive, microbiome, and hormone conditions and integrative fertility.
I'm Dr. Ami Kapadia. I'm a medical doctor trained in family medicine and functional medicine with a special interest in combining standard therapies with lifestyle and nutrition-based interventions.
And I'm Dr. Alana Gurvich, a naturopathic physician, licensed acupuncturist, and a fellow of the American Board of Naturopathic Gastroenterology. I specialize in IBD, IBS, and other functional GI disorders. Let's dive in.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Everyone, we are here with Dr. Sand doing part 3 of the Gallbladder Series. This one will be what you can actually do when you have all of these complicated situations.
With the guidance of your doctor.
Right, don't just go for
But
it.
we do talk about some ideas here that are probably thinking outside the box a little bit. This isn't going to be specifically stones, but if you listen to parts 1 and 2 of this series, learning all about the gallbladder and the microbiome and the gallbladder and the hormone system, specifically estrogen for people. So now let's talk a little bit about what we do. Just to kind of recap maybe some of the conventional approaches.
Get your gallbladder out.
That's it. Yeah. First thing, take it out laparoscopically, hopefully, and just remove it. The TUDCA, these are kind of used in pregnancy.
Bile salts.
Yeah. Just supplementing them. You can use ox bile as a supplement, but that isn't going to do as much as it really helps digest your food, like with digestive, directly with eating is sort of when you see it. What's your experience?
Ox bile,
Yeah.
sometimes for some people, but it's not reliable.
Yeah, it's like cool in theory, but I don't really see it do a ton. So low-fat diet counseling is also generally what's recommended.
Which is hard.
It's hard. It doesn't taste good.
Even though I will say there was an entire generation that didn't eat fat.
The
Tasty
90s.
cakes.
Yeah.
The low-fat tasty cakes.
And those low-fat chips or fat-free chips, remember? That just made everybody poop their brains out.
Oh,
Yeah,
right,
the Olestra.
Yes.
Yeah.
What was it?
Olestra.
Yes.
It's still a
remember.
prescription.
They were marketed
For diarrhea, for
I
constipation.
mean, I would never give it to anyone.
For
It's
weight loss.
For weight loss.
but you are signing yourself up for some diarrhea.
Yeah.
I remember when those chips came out, I was in like elementary school or something, and they were so well marketed that I was like begging my mom for them. I mean,
Marketing.
not because I wanted to lose weight or anything. They were just like so cool and new.
Yeah.
And yeah,
I
anyway.
remember the low-fat tasty cakes, the chocolate ones with the white
Yuck.
on the design
I
on the
love
top.
fat so much.
I know,
I mean, I
but
just
that's
wanna
what that
say-
was marketed, right?
That entire generation
I
just
know.
replaced fat for carbs.
Yeah.
Yeah.
And that's where we are now.
Exactly. I know. It's a huge thing. And I still have a lot of patients who deal with fat like fears,
Mhm.
because they were taught it's bad. But I'm like, man, if you want to regulate your insulin, if you want to feel good in your body, have energy and have your brain work, like you really need fats. But we really bred this generation of people who are afraid of it.
I can remember when I was in naturopathic school, maybe just out, somebody introduced me to a book called Eat Fat, Lose Fat. And it
Yeah.
like blew up
Because
my
you're
mind.
so full with protein. Like, just eat fat and protein. You're not even going to want dinner by the end of it. Anyway, okay, so that's one option. And then bile acid sequestrants, which we use all the time too. But that's sort of like the mainstay of conventional approaches. So here is what I think conventional medicine approaches largely miss.
Everything. Sorry.
Not everything. We
Not
use,
everything.
we use
I know,
those tools
yeah.
too. Get your gallbladder out if you need it. Like don't mess around with that. The post-cholecystectomy microbiome consequences.
They don't park you about that.
Yep.
For sure.
They definitely don't park you about that. They also just never think about it really in what happens afterwards. Metabolic downstream effects, MASLD, metabolic syndrome, all of these like liver disease that can happen from that. The estrogen bile microbiome interplay in menopausal or perimenopausal patients.
Which, if we're honest, I didn't think about until last episode.
Yeah, thought about it, but not as much as I needed to because
Yeah.
I didn't really understand the physiology of what was going on then and how to intervene. Yeah, listen to the episode 2. And then the concept of addressing why the gallbladder needed to be removed in the first place. Yes, if it needs to come out, great. But like also let's figure out what predisposed you to that and what else you might be brewing. Something happened. It wasn't a fluke. Something happened and maybe we can figure out why. Let's talk about how we can help. So what were those amino acids that we really want to
Glycine and
focus
taurine.
Good job.
Why? Why do those matter?
Because they conjugate the bile salt.
That's right. They are used to conjugate bile salts from the liver so that we can actually use them in a better way to digest our food. These are going to be particularly helpful in people who have low stomach acid states.
Oh, wow.
So
That's
think about
something
that.
you brought in.
Also people who have liver stress, which could be defined really broadly. But if the liver is under duress for whatever reason, maybe medications they're on, lifestyle choices, things like that, they may also benefit from adding these amino acids in. And obviously people who have their gallbladder out.
That makes sense.
Yeah.
So think about that supplementation. Bitter herbs.
I love bitters. I do.
Do you want to name some of your faves?
Dandelion. Three.
I love gentian, but man, is it bitter.
You mix it with something, right? What did we have it in the mix? Yeah.
Yeah.
And then it tastes okay, right?
No, it tastes better.
It might taste worse.
It's
but
very
you can mix it with like orange peel, peppermint,
which
ginger.
makes everything else just taste worse.
Ginger?
No, I mean, it's really bitter. Gentian's really bitter.
Yeah, it is really,
but
really
the
bitter.
gentian scutellaria mixture is a little bit of magic.
Yeah.
Yeah.
It does wonders for people, but yeah, including your gallbladder. These are classic cholagogues, which, you know, is related to the gallbladder, and they stimulate bile flow and support contractility. So based on our last episode, what populations might this be really helpful in?
Somebody who is perimenopausal or postmenopausal.
Yes. Bitters. Let's use them. And they also help with digestion and like everything else in the body.
What do you guys think of those Swedish bitters, the commercial?
That is actually what I recommend patients to get. Just go to the liquor store, get the moonshine bitters, mix it with water. That's your cocktail while you're cooking dinner.
Yeah.
If you're cooking dinner.
Yeah.
You should be cooking dinner.
Cook dinner. Yeah. And if not, bring it to the restaurant with you. But you can also do it after if you forget.
Also, there are spray bottles that are available.
That's a spray. Yeah. It comes in sprays too.
Yeah. And that should you just like hit your mouth with it to start the digestive process.
Yeah. They're amazing. And they're really helpful for your gallbladder. Phosphatidylcholine and lecithin.
Lecithin.
Yeah, it's a weird one.
Lecithin.
Yeah.
What did I say?
Something else.
Lecithin.
I tripped over my tongue on that one. So these help keep cholesterol soluble in the bile and reduces stone formation.
Because they are the building block of the cholesterol molecule. It's kind of rad.
That's rad. Yeah. And this is a population, so stone formation is high estrogen states. So people in high estrogen, which you dip in and out of in perimenopause, but this is a huge problem in pregnancy because your estrogen is through the roof for these people. Oral contraceptives that have combined contraceptive have estrogen in them. All my pregnant patients get choline, non-negotiable. All of them are on choline.
Right. And that is to support the estrogen. Why is the choline there?
The choline is for the baby development, and then postpartum is for preventing mastitis.
This is the new folate.
It's the new folate. Yes.
Oh, really? It's recommended by everyone?
Most prenatals do not have near enough choline.
How much do you need?
I do 400.
Oh, I'm looking at 100. I'm like looking for a prenatal 100.
It depends on where you're at in pregnancy.
Okay.
But the max is about 400. But now I know it has all these benefits for your own brain and memory, because anyone who's pregnant knows their brain does not work right for a while, you know, afterwards. But it also helps your gallbladder and prevents stones. You have choline, but you have to eat about 4, I think, at least to get enough every day.
That easily.
Yeah.
4 a day?
I mean, I might be wrong about that. It might be, I don't remember how much choline is in it, but that's your main source.
That's my favorite food.
Yeah. So choline, you can get like super cheap 450 milligram tablets and just supplement that, add it to your prenatal.
Interesting.
Some prenatals have that much, most don't. It's like the prenatals where you have to take 8 pills per day, which no one does.
Yeah, I will say I am usually, I think it's a good one if it's got 100. So that's good to know.
Exactly. Yep. So add the choline for your prego patients. Calcium, which we love. For everyone. Also great for perimenopause for so many reasons, but it's specifically for the gallbladder. Supports smooth muscle functioning.
Do we know what type of magnesium?
Glycinate. I would do glycinate.
That makes sense.
Yeah, it's kind of the winner for if you want it absorbed.
Yeah.
You know? But for gallbladder contractility, which, you know, is very responsive to our hormones. So think about that.
Especially progesterone.
Yeah. And it's magnesium is commonly deficient in perimenopausal and menopausal women.
Also, every woman and every man.
And everyone in America. And toddlers, I recently learned, are very mineral deficient.
That makes sense.
Because what do they eat? French fries.
Yeah.
And chicken nugs.
Oh, who doesn't love French fries?
My kid eats French fries and chicken nugs.
Oh, really? That's her diet?
I mean, that's not her whole diet.
She eats edamame. I told you to stop eating yogurt, toast and butter. That's basically French fries and chicken nuggets.
No.
We're on a very white diet.
I mean, that's what happens is like you go big and then it gets littler. And then now I think my 10-year-old is just coming out of the littler a little bit. He's willing to experiment.
He really likes the same frozen pizzas I like.
Oh my God, he loves frozen pizza. In fact, if I say we're having frozen pizza for dinner, he like throws a party.
Yeah,
I know. I saw him last time you bought him.
Same with us. I've been on the phone with you where you've been guiding him and cooking frozen pizza.
Yeah. Because he's 10.
What does work, this is like a no-brainer, but I'm seeing it in action, is we now have a garden in our backyard. There's a lot of work.
The vegetable.
She loves it.
Yeah.
She goes and eats like sorrel, kale right off the stalk.
My son actually, because we had a garden, he would eat kale, and we were at the grocery store once. I think I told this story on the podcast already. We were at the grocery store and he was like, Mom, it's kale. Can I get kale? Can I get kale? And somebody was like looking at him and looking at me, and she was like,
so
what did you do right? You did something so right that your kid is like jumping for a kale.
Yeah.
But I think it's growing right off the stem. Like, it's kind of amazing.
We're not there
have
right
aphids. Ours always got aphids.
That happens later. Early on.
With it.
I don't tell her. Protein.
It really, I can't eat it if it has aphids.
I know. I'm
it's
with
better
you.
I don't cook it.
Okay, so now let's dive into what we can do to just kind of generally support people who have their gallbladder out.
Okay, that's me.
Yeah. What are some things that we might want to do? Like if they're kind of symptomatic. What are some things we might want to
So you definitely want to do bile acid sequestrants.
Yeah, if it's bad enough and that doesn't cause constipation. Yeah. Adding fat-soluble vitamins. It's probably a good idea for most of these people. I think most of us have on our radar vitamin D for sure.
I mean, we are in Oregon.
Do you want to layer in the other fat-soluble vitamins?
A, D, and K. There's some good vitamin Ds that have all of them actually.
Yep.
Except the E.
Yep.
It's hard to find combo with the E, but they often have A, D, and K.
Yeah. So that's just going to be more relevant for these people. Obviously, fat-soluble vitamins you can overdo. They do store up in the body, so you don't want to just down these willy-nilly. It's just the only one we can reliably test for is D. The other ones don't have good testing because of their storage. So just have that on your radar. We've talked about a lot of these, the ox bile, the other bile digestive supports, but digestive enzymes. My question for you on this was you can get digestive enzymes with vegan lipase in it.
Can.
What do you think about vegan lipase versus the animal-based ones?
Great question. So vegan lipase is made as a byproduct of mushroom fermentation. And I would say that for some people, it works well.
Is it because it's in combination with other enzymes and that works?
So there's a lot of different products out there. There is now a pancreolipase equivalent that's made from fermented mushrooms. That's 100% matches USP of the lipase that we have.
I'm very curious about that.
Same company that you usually use?
Different company. It's the only product that's on the market.
Product.
Wait, a pharmaceutical?
Nope, supplement. But is it reliable? For some people, it is very effective. For some people, it works better. For some people, it works worse.
Dosing the same?
You dose it based on the same USPs that you would dose lipase.
Great. Well, that's encouraging.
Yeah. And it's not like, because most of the lipase that we're seeing from vegetarian sources are like very low dose, like 1,500. And they're using huts usually, which should be a 1-to-1 conversion to a USP. But our lowest dose that we're using regularly is 25,000. Yeah. So 1,500 lipase.
Right.
Those enzymes might work, but they're working because they're supporting the cellulases and all the plant matter derivatives. They're not working different because of the fat.
We have a whole episode on this, don't we? Digestive enzymes.
So too.
Yeah. Check what we've talked about. It's been a good 4 years.
We spent a lot of time in the closet.
Yeah. All right. And then one other shout out. Do you want to guess?
Shout out.
Oh, psyllium. Is it psyllium? Oh yeah. It's psyllium.
Just a general throw it in. Yeah. So psyllium fiber, one of my true loves in life, binds excess bile acids in the colon, reduces bile acid malabsorption, and feeds your good bacteria. So it's a triple threat. It does a lot for the gut. Yep. Love it. And it doesn't contribute to gas load.
It's probably better tolerated than the cholestyramine and cholestyramine.
For sure.
Yeah, and it's not going to work out as well. Yeah. So if people are pooping their pants, psyllium probably won't help.
I will say it's tricky because for some people it works better.
Yeah.
You know what I mean? Like some
depending
people
on the
get
mechanism.
such a constipation reaction from the bile acid sequestrants that a soluble versus soluble and insoluble therapy has more efficacy. It's so person dependent.
It is.
I mean, that's why working with somebody who understands the nuance is helpful, but I know it's not always possible.
It's not just a protocol.
An algorithm? Not yet for this. Then butyrate supplementation.
Oh, butyrate. That's my new favorite.
A very bad smell.
Sure
but
does.
If people say it works, patients have said it works.
Yeah, I find you have to dose it kind of high. Is that what you're experiencing?
So I went through this whole thing where I was like using like very, very high dose butyrates for IBD. Rectally and orally. Didn't see anything. Then I forgot about it. I was like, no. And then I kind of started literature on it again and started using it again. And I feel like, not insanely high doses, like 1,200 to 2,400 milligrams once to a couple times a day could actually have some efficacy for the right person. Yeah. So
that, you can take a pill. You can also feed your butyrate producers, which we talked about in, I think, episode 1 of this series. Yes. Basically the bugs that make butyrate for you in your colon, which is excellent to do. And that's resistant starches, psyllium, flax, and that's kind of it.
Any fiber. Any fiber.
You want to do fibers, but the resistant starches, especially, they love to chomp on. Okay, so let's get into specifics now about the estrogen microbiome gallbladder access.
And we can say the estrobolome gallbladder access, right? That would be saying the same thing.
Yeah.
But with less words.
Yeah.
That are harder to define.
If people know what the estrobolome is. Yeah. But maybe our turds know that. Yeah. You've been listening long enough, I hope. So the gut microbiome regulates estrogen recirculation via an enzyme called...
beta-glucuronidase.
I love when I ask such easy questions and you're like, beta-glucuronidase. Yeah.
I was like, that's not even a quiz.
No, it's not even a quiz. Yeah. What are some supplements that act, or what is a supplement that acts on beta-glucuronidase activity?
DIM, right?
Oh. But similar.
Calcium-D-Glucarate?
Yes.
Oh.
That's your favorite supplement.
That is my favorite
supplement. They work synergistically, especially when we're talking about gallbladder, though.
And estrogen.
Yes. Yeah. Yes. So calcium-D-glucarate inhibits beta-glucuronidase activity. Beta-glucuronidase is an enzyme made by...
Calcium-D-glucarate inhibits beta-glucuronidase activity, which means that it increases the amount of estrogen that's circulating?
No. Beta-glucuronidase, so you can think of it as like beta-glucuronidase recycles estrogen that was meant to leave the body.
Okay.
So in a dysbiotic situation in our microbiome, we have more beta-glucuronidase, which makes estrogen be recirculated when the body never wanted it to. It was supposed to leave with our poop, but beta-glucuronidase is like, we like you, let's stick around. So we want to inhibit beta-glucuronidase activity with calcium-D-glucarate so that estrogen that was slated to leave the body leaves the body and stops causing estrogen symptoms like excess binding to the gallbladder and whatnot. So think about this. I mean, we think about this in like the high estrogen states anyway, but perimenopause is a good one. PMS, PMDD, are good ones. It also works for the gallbladder. Okay, DIM. DIM does a couple different things here that are worth noting. So it supports that 2-OH estrogen pathway. In the context of gallbladder and biliary health, though, this matters more than maybe we thought. So
I know, I just learned that last episode.
Yeah. So DIM promotes phase 1 hepatic hydroxylation. So to this weaker, less proliferative, less lipophilic estrogen metabolite. That's what we're talking about with these different types of estrogen. There are tests on the market that can kind of help you determine if your body tends towards certain types or not. But there are different types of estrogen in the body that cause more problems for people. You want a good, healthy balance of them. None of them are bad. It's just where your body's shunting it to. So the alternative pathways, the 4-OH and 16-alpha hydroxy estrogens, produce more reactive, more lipophilic metabolites that are more likely to be secreted into the bile. So I didn't really think about how that gets into the bile or not, but that it's problematic not for all the cancer reasons and growing tissues reasons. It's also problematic for our gallbladder. And when in there, it may contribute to cholesterol supersaturation and stone formation.
Wow, that's interesting.
So DIM supports liver phase 2, liver detoxification as well, glucuronidation and sulfation, working synergistically with calcium-D-glucarate. So use them together to stop reactivating these estrogens and also ensure that we have the less reactive form of estrogen binding.
So here's my question. I have a patient, she's a gallstone patient, right? So she's got this, at least we know she's got some kind of dysfunction in her gallbladder. She doesn't want to get it out. She is HRT menopausal patient, right? So should I, just for protection, is the HRT enough of a protective factor for the gallstones, or should I be introducing something like, support of these pathways to improve?
It may be a time that testing isn't the worst idea.
Hormone testing.
To see what her body is doing with estrogen metabolites.
Or can you give her estradiol?
Well, I'm giving her stuff to break down the stone.
Okay.
I'm working her on a gallbladder.
She is a gallbladder person. So
she is
yes. I would say yes. I would say if you're thinking that there could be a gallbladder thing, but you don't know, then maybe test.
Yeah.
But in her, definitely, I would give calcium-D-glucarate and DIM.
Interesting. But wouldn't that make the HRT less effective? No.
Just changes the recycling, I guess, right?
Yes. So these do not affect your endogenous hormones or what you're putting in through HRT. What they do is hormones that your liver decided need to go. It's like when things get in the way, when your physiology gets in the way to help it go, it sends it back in. But the body never wanted to keep those estrogens. So it's not going to decrease estrogen levels that your body was using.
That's an interesting concept.
Yeah.
Yeah.
So it's not like calcium-D-glucarate, everyone's like, oh, it made me too low estrogen. That's not a thing. It's not a thing that it does. It really just works on the microbiome.
For my body, at least, calcium-D-glucarate is like borderline magic for PMS.
Just pair it with DIM if there's a gallbladder. I mean, pair it with DIM for a lot of reasons, but pair it with DIM for gallbladder issues. So to just kind of recap, together, the calcium-D-glucarate and DIM both address both the quantity, how much estrogen is being recirculated, and the quality, which metabolites are circulating, because they're not all the same for all reasons, but for the gallbladder as well. So then we also can talk about liver supports like milk thistle.
Oh, I love milk thistle.
We love milk thistle. Yeah. It's hepatoprotective. So it's good for your liver. It supports bile flow, and it's anti-inflammatory, which cover a lot of the bases of what can go wrong here. NAC. Why would we consider NAC? This was a big one that, we give NAC out for kind of everything, but why specifically for the gallbladder in like
because it helps those sulfurination pathways.
But antioxidant.
I don't think that's so interesting. I know it's an antioxidant. I just don't think of it that way.
Totally. Yeah, it helps. So I think I actually probably primarily use it as an antioxidant. I use it a lot in fertility support and endometriosis because our ovaries are so susceptible to inflammation in the body, and NAC can help with ovulation for all these reasons. But also the gallbladder is very susceptible to inflammation, and the way that estrogen, as we learned about in the last episode, affects the inflammation, or removing the gallbladder or going through menopause, you're more predisposed to having inflammation affect our biliary system. NAC can help with that.
Do you guys also use castor oil packs?
Great idea. They're just a lot of work.
It's like a naturopathic thing.
Yeah, it's like a naturopathic staple. And I think that some patients use them and love them. Yeah. It is a lot of work for me personally.
Yeah, you have to get your setup. I think if you do it enough to notice the benefit, it's great.
Didn't we? I feel like all of you said you just have people use the roll-on at night and then put that cloth on that you would give them.
So what I do when I have it is now there's a roll-on. I used to just use the liquid and then I have them sleep with like a tank top, and then I put a towel that they don't really like on their belly, and they just go to sleep all night. And that is helpful because it won't stain the sheets, but you also should not be attached to your sheets because it's thick and oily and greasy.
Right. Maybe some people have nicer sheets than ours. Yeah. Everyone probably had.
Well, yeah. I mean, I think castor oil would be a great idea.
Yeah, I don't think it's going to hurt.
It can move things though, so you got to be a little careful with stones, especially if there's a risk of a clog or something like that.
I mean, I hear. I don't think I would give it to my patient that we talked about 2 episodes ago, who's got a stone in her neck.
Exactly.
But
maybe just like motility and stuff, where you're not worried about something
if there's
obstructing.
An active stone issue, maybe don't. I mean, really, because you just don't want to. You don't want to be the last name on some issue. Yeah. But I am thinking more about NAC for people who had their gallbladder removed and now are going through menopause.
Right.
That's kind of how I'm thinking about that.
It's restoring that antioxidant function.
Right.
Right. That makes perfect sense.
Yep. For biliary health. Okay. So hormone therapy considerations. So anyone want to recap some of that we learned last time?
If you're thinking about a patch is generally considered safe and oral is a little bit less safe, progesterone slows motility even more.
Yeah. So be careful with oral estrogen in any form, birth control, any of it, for someone who has active gallbladder disease. And really what I do now is a more thorough GI intake that involves gallbladder issues to see if it would be a good fit for them, or if we really should be pushing for transdermal routes.
Yeah, I guess I was like percolating through all of these episodes that we've been talking about. I'm like, should I be imaging these women who have a predisposition more?
I don't know. I wouldn't say definitely yes.
No?
You guys have heard me talk about incidentalomas. I would not go imaging people.
But like a HIDA scan.
Anything you get, a HIDA scan, I don't see anything negative that could come out if they're symptomatic. Any other imaging test, please do not get on anyone that does
right upper quadrant pain?
Right.
Then you have to get something. Yeah.
That's really what I'm thinking.
Then you have to get something.
If they're generally with gut stuff, you know, I'm probably just going to work up gut stuff, but I'm going to be more careful about asking about right upper quadrant pain, but it is going to level up a little bit my differential if they're also in perimenopause.
Yeah, I think Lana was saying she image people that are
just for
menopausal, perimenopausal,
for stones
with gut,
without symptoms. Patients are going to have symptoms.
But you know, what I have very tell everybody is anything that lives from the collarbone to the pubic bone can be caused by anything that lives from the collarbone to the pubic bone. So just because it's an upper right, just because traditionally we see upper right quadrant pain, that's not what we always see. Right. Sometimes that pain is also diverse.
Yeah. I had shoulder pain with my appendicitis. Right. Complete opposite side.
Oh, weird.
Yeah. They had no idea what was going on.
Anything that lives from the collarbone to the pubic bone.
Yeah. I was pushing that collarbone limit. Yeah. It's crazy.
I mean, that makes sense. You have to get imaging then if they're having pain, but
Interesting.
Yeah, so I think HIDA scan specifically, it's gallbladder ejection fraction is what we're looking at, but perimenopausal people.
That's not a very sensitive test.
I think it's just a test we have.
And it's not like I've had people with normal HIDA scans who were having terrible gallbladder dyskinesia. You know?
Okay, so what other tests, maybe let's just jump into that. What other tests might we want to consider for people with gallbladder stuff that outside the usual ultrasound, like now knowing all this information?
I mean, microbiome testing is definitely on my list. Also, maybe looking at their bile salt breakdowns.
Like just to see.
Yeah, it's in a lot of the microbiome panels anyway, but that's a distinction with different types of bile acid dysfunction that you can have. I'm going to be looking more at short chain fatty acid producers.
Like you're looking at the microbiome that makes.
And seeing if they're super depleted.
I mean, a lot of the testing that is available in the functional space is also looking at stool, short chain fatty acid.
Yeah, so looking at those and their producers, which go hand in hand. But none of these tests are perfect. Like there's so much nuance with these tests. I think having both sides of that lens might be helpful. And maybe you consider butyrate for those people to kind of help level it out. Obviously, you want to be looking at liver enzymes. You want to be looking at cholesterol because we build bile from our cholesterol, but you don't want too much of it. So that causes issues for people too. Fat-soluble vitamins, especially if they've gotten their gallbladder out. We talked about that. Are you using OAT tests at all? Organic acid tests? Sometimes.
Yeah, you're probably not at all.
I used to.
You used to?
Yeah, I used to.
Did you find them
I
useful?
had another question we can come back to. I wonder if there's and do people who are on statins have more gallbladder issues because they don't have building blocks for bile? Or does it only deplete what's in the blood at the time, but there's still body stores? I've heard that.
Well, generally people on statins have plenty of cholesterol. You know, it doesn't bring it down too much.
Well, we're bringing it down pretty low.
Now we are.
I mean, now we are.
So I'd be curious if there were any studies on like,
I wonder.
They develop more. Anyway, that's for another day.
Totally. Yeah. If we lose the building block, you know where I see that be a problem, not really statins, but too low of cholesterols for hormones because we build our sex hormones out of it as well.
Okay. So if they're on the medications, they're having maybe more hormone issues sometimes.
I mean, obviously my people who have like hypothalamic amenorrhea or like aren't eating enough, you know,
diet related,
lose their period kind of stuff. But it's that really my fertility folks, and they're not as much the folks taking statins. And obviously that's a anyway. So, but I mean, I think that all those systems overlap. Who would have thought? I learned that for mitochondrial function markers on the OAT test, I know I'd get you
I
on
love
that
mitochondria.
One. So pyruvate lactate, alpha ketoglutarate, succinic acid, fumarate malic acid. So Krebs cycle, that might be reminding you of that Krebs cycle thing. I had a point in college where I was like, should I just get a tattoo of the Krebs cycle? Because I'm tested on this so much.
Really?
I mean, you missed your opportunity.
Well, I was
right here, right here.
Yeah, I know. I was just like, I have to memorize this like every credit. It never just stuck in my brain because like you never use it.
No.
Yeah.
Well, apparently on OAT tests, you can look at that, but these are relevant because chronic fat malabsorption reduces our fat-soluble nutrient availability. And mitochondria need these.
Yeah, and you know, mitochondria is made of that phospholipid bilayer. That lipid is in there.
Yes.
And so it needs stability.
Yeah. So I don't know if I'm going to do. Generally, OAT testing, people come to me and already have had it, and that's where I'm like, oh yeah, this maybe looks like candida, and whatever else.
I use it in the context of toxins.
Oh yeah.
Like if I can't figure out what's wrong with them, like I have a couple of patients right now that I'm managing their weight loss with. And they're not losing any weight.
Wait, do you mean they're on GLP-1s?
They're on GLP-1s and they're not losing any weight. And I cannot figure out why. And so it's that population where I'll be like, I think we should look at your toxins. Yeah, let's look at your toxin load to see what I'm missing. And like that's where that kind of testing comes in helpful for me.
Yeah, I guess I wasn't aware that there was so much that could tell you about fat absorption patterns and bile patterns. Yeah. And that was new to me. But I don't know that it's going to. That test in and of itself isn't going to change too much on treatment right now, but it might help elucidate like some of the pathways that are broken.
Yeah, I mean, the other place where that test is useful, I think, is if there's like that chronic constipation, there's obviously some kind of dysregulation of the bile and the microbiome. That is another useful way of me looking for fungal dysregulation.
Yes, totally.
Like, that's where I also think that test is useful.
Yeah, but are you ordering it for that?
Sometimes if I stall out and I can't figure out what's happening, like I think
the picture a little bit.
First, it's a really good history, and then if the history doesn't tell me, then I'm going to look at the microbiome. But like as I'm peeling back layers and they're not getting better, then I'm like, okay, what pathway am I missing?
Yep.
So yes,
there's many to miss.
The other just kind of like last test in here, and like we talked about microbiome, I want to like just shout out to that one. There's a lot that we just kind of said microbiome testing, but that's almost all of our episodes. That includes things like SIBO and biofilms and all the other stuff that can go. And elastase, you know, looking at stool elastase, because that will mess up this whole flow as well. Hormone testing. I wouldn't say maybe do hormone testing for your gallbladder, but if someone comes back with like a 400 estradiol in serum, maybe ask about how their gallbladder function's going.
That's a good point.
Do you check blood serum hormone levels regularly?
Yeah.
On that
day
same
3 to 5.
Yeah.
That's not regularly. And I tell people, like, this is a point in time, especially if you're in perimenopause, expect them to fluctuate. It may not change what we recommend for you. I don't change doses based on serum levels, but if I test you and I catch that your estradiol is 450, that does change what I do.
You're doing day 3 to 5 too? I thought you're supposed to check progesterone further along.
I don't test progesterone unless people are trying to get pregnant.
Gotcha. So you're mostly testing estradiol.
Me too.
Okay.
I do estradiol, sex hormone binding globulin, testosterone free in total, DHEA. FSH and LH, depending.
And I tell everybody that estradiol is a very crappy test because your estrogen literally goes up and down all day long.
And so FSH will influence it. So usually you want to do both.
So I always say the only reason I'm doing the estradiol is really tell me if the FSH is real.
Yeah.
Because I'm trying to figure out how close are they to menopause.
Yep. Yeah. But that fluctuates too.
It does.
So it's a point in time. Yeah. Huge caveats, but I don't think it's useless.
Yes. But I also don't think it's
the estradiol helps you figure out if the FSH is accurate.
Elevated estradiol can suppress FSH. And progesterone is released when we ovulate. So I want to be really clear about that. I see so many people being put on progesterone because their progesterone zero. Meanwhile, they tested it during their period.
Day.
You shouldn't have progesterone
it's supposed to be
unless
a week
you're
before
pregnant.
If you are going to test it, right? Day 21-ish.
But then that's a looking back. That's 21 on a 28-day cycle.
It depends what your cycle is.
7 days
before it depends when your day 28 is.
So and in our 40s, like you're going to ovulate wonderful, maybe even double sometimes. You're not going to ovulate certain times. You're going to have not a robust ovulation sometimes.
Unless you're on the herbal that you recommended when I talked to you 3 years ago.
Vitex can
I
help.
always say during perimenopause, just like the rest of you, your ovaries go rogue.
Yeah. They're figuring out their new job. You know, it's cool. It's great.
They've been churning out eggs for a long time.
That's what I say. They're retiring. It's amazing.
Can we retire? Oh, sorry.
I don't want to retire.
I have so much fun with
this.
Yeah. So how this changed my practice, just in short, because that's kind of what I'm capping these with. Post-cholecystectomy patients now get microbiome support. Like, I think we talked a lot about the different strains of the very common probiotics. We prefer food sources, but I don't skimp on that now. Like, if you come to me and you're menopausal, we talk about probiotics, even if your gut is fine. And then I've become much more intentional about taurine and glycine conversation.
I love taurine and glycine for
and glycine helps you sleep.
Oh my god, it's so good.
It's calming. It's amazing.
Opens the door so the glycine helps you sleep even more.
It's an excellent combo.
Yeah,
it just also is great for your gallbladder.
There's a nice magnesium glycine combination product, I feel like.
Oh.
Or maybe that's another country. I don't know. Dr. Biden recommends it in their book, and I can't remember if we can actually give it to people here or if it's in her country.
And also throw magnesium in there.
With that
magnesium glycinate.
Yeah, that's true.
I feel like those are all powders, or I can take them in powders. It's a little bit nicer, I feel like.
Than pills.
Your little nightcap.
Yeah, that's what I do. My nighttime tea. I love it.
Amazing. Oh, you put glycine in it, right?
Glycine, taurine, and inositol. And inositol is very sweet.
And magnesium. Do magnesium.
And magnesium.
Yeah, inositol is great.
Should we recap?
Yeah.
So what do? We support the hormones.
Yep.
We support digestion with bitters. We support bile production with glycine, with taurine, with TUDCA, with lecithin.
Enzymes if you need
Enzymes.
Yep. Yeah. Microbiome, I think, is just huge here because that's what we talk about here anyway, but there could be a microbiome conversion issue going on, so don't miss that for people. Support the liver. Did you say that one?
Support the liver.
Yeah.
Yep.
When in doubt, treat the liver.
Yep. And then calcium-D-Glucarate DIM. Just, they're great.
Actually, that was Burley.
Thanks,
we have another 12 episodes in the series, right?
Exactly. Probably by the time I have another patient where I'm just like, wait a minute. But yeah, thanks for joining us.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the turd nerd word.
Eee!